It is my great pleasure to host the Dr. James Stevenson, fondly known as Jim, one of the world leaders in neurology, the current president of American Academy of Neurology, which is the organization which had been responsible for spreading neurology education worldwide since A.B. Baker days onwards. Funnily enough, Jim, the first membership that I obtained before I even a neurology resident is becoming an AAN junior member in 2003 for the value that it was providing. Jim, as you are aware, we are in this unprecedented era in the middle of a pandemic, which you and me didn't predict. But at the same time, we know that there is a different kind of pandemic, that being neurological disorders being the leading cause of disability and second highest cause of death. We also know that the number of Parkinson's disease patients are exponentially rising globally, at almost doubling the prevalence of Parkinson's disease from 1990 to 2016. How excited are you as the president of American Academy of Neurology, as well as one of our regional directors of World Federation Neurology, to see WFN and MDS, AN, EAN, all these global organizations are rallying around World Brain Day to talk about Parkinson's disease?
Well, thank you so much, Professor, for allowing me time to visit with you today. In this time of the COVID-19 pandemic, I think it brings even greater focus on the importance of us working together to try and attack diseases that involve everyone in the world. And it's always been my privilege to work with my colleagues in neurology from all over the globe to try and help educate, promote research, and to improve patient care and the diseases that we have dedicated our lives to in order to find answers and to work with my colleagues to hopefully eventually find cures to these illnesses. So every year, the American Academy of Neurology supports World Brain Day in an effort to help raise the awareness of neurologic disease. This year's campaign, as you mentioned, is focused on Parkinson's disease. And we need to advocate on how to better change the lives of the more than 7 million that are affected, as well as their caregivers, and encourage the development of research and better ways to care for these patients to improve their lives. So we're very excited this year to join the WFN and my colleagues across the world to promote this issue.
Jim, we are incredibly grateful for AAN. I always tell that AAN is actually a global organization. It doesn't only belong to USA, and it belongs to the whole world. And the AAN contribution of Continuum Journal is one of the key things that we share to educate our colleagues all over the world. Jim, thanking you and AAN for all those great things. I'm going to change the direction a little bit to a different direction. Now I want to talk about you. Tell us about your early days in medical school, or even before that. What motivated you to get into medicine? Tell us about your background.
Sure. Well, I grew up in the center of the United States in a small Midwestern town. I came from a family where I was the only son, surrounded by 2 beautiful sisters on each side. So I had 4 sisters in my family. And my parents really were the motivators for me to look into a career in medicine. My father was the first in his family to ever go through college. His parents worked in a chicken hatchery. And my father actually paid his way through college by doing something called chicken sexing in a chicken hatchery, which it's too long of a story to tell today, but true story. And he taught me the value of being curious, of working hard, and setting your goals. When I was in high school, I had the typical interest of any high school young boy, which were girls, athletics, and I would study sometimes. But when I got to university, I was really intrigued by courses that I took in neurophysiology. And I thought this was very, very interesting material. And I was exposed when I was in college, starting in a kitchen in a hospital, and then worked my way up and worked on the floors, and then ended up working in the emergency room to see if this was something I could do as a career. And so pursued that and was fortunate enough to be accepted into medical school. Once I was in medical school, again, the challenge and the interesting material all the way from neuroanatomy to neurophysiology, I really thought that, wow, this is one, a challenge, difficult material, but one that you would try and master and probably never could your entire lifetime. But also it was an area of ultimate challenges and opportunities. And I thought the brain and the nervous system is still the final frontier in medicine, the black box that we need to learn so much more about. And I thought it would be interesting across my entire career to make discoveries and find therapies and hopefully find cures. And I have not been disappointed in my 35-year career in neurology. It's proven to be very, very true. In my lifetime, we've made many exciting discoveries concerning neurologic disease and come up with neurologic therapeutics. And that I find that probably in the next several decades, it will continue to hold true as we learn more and more about the brain and the nervous system. And so I believe that it was those things, just the challenge, and also as many of us, we have mentors or teachers who excite us about a topic. And I was fortunate in medical school to have 5 or 6 outstanding professors in neurology who really piqued my interest and encouraged me to pursue the field. And it's something that every day I have to say, and you want this for anybody, that I wake up every day excited about what the possibilities will be in my professional career in neurology.
It is certainly not a boring specialty at all, because you never know what's going to hit the door next moment.
Correct. Yeah, every day and every patient is a unique opportunity.
Absolutely.
And every day is a learning opportunity, and I find it very rewarding.
Jim, you also have special interest in sleep neurology, and you have done a lot in that field. How did that come about?
Yeah, it's so interesting that when I finished my training in neurology residency, I went and joined a group, and that I wanted to please the senior members, and they said, Professor Stevens, you should go learn sleep medicine. And
right.
So I wanted to please the group, and that when I was a resident, I was exposed perhaps to a few patients who had the interesting disorder of narcolepsy, and then also saw patients in those days, they were almost all very Pickwickian, large people who had sleep apnea and knew a little bit about it. Was so kind to send me, so I did studies at Stanford University and the University of Alabama, Birmingham, to learn about sleep medicine. And this was in its pretty early days as far as a specialty. And came back because I told them, if I'm going to do this, I want to do this right and learn as much as I can. And so that's been a very part of my career as well, being able to do research projects and also to help people who have this very specific disorder. In my personal practice, I probably see 30%, 40% of the patients with sleep disorders, but also love the opportunity to see general neurology patients. So I see the whole spectrum and enjoy every bit of it. But sleep medicine has been really a wonderful adjunct to my career.
Jim, I think you made a very valuable point. What I personally learned or continue to learn during this pandemic is how important for all of us to be exceptionally good at general stuff and general neurology, general internal medicine in particular. We all go back to basics, and we are talking about neutrophil lymphocyte ratios, neutrophil platelet lymphocyte ratios that we conveniently ignored for decades in the past.
Yes, yes. And I think it's so important that as neurologists, we realize we have that common experience, meaning that we all have been trained in the basics of our profession. And I think that's a bond that keeps us together no matter which avenue you choose in your career, whether you're going to be in research primarily, whether you're going to be an educator at an academic center, whether you're going to be a community neurologist. We all have that bond and we all have that love for our profession. And that's something to always keep in mind, I believe.
Jim, my next question is AAN impact in global neurology is enormous. This is not the forum to talk about that, but everybody knows about that. Tell us about your early days with American Academy of Neurology. Did you ever think that you were going to be the president of American Academy of Neurology when you joined AAN?
No, that was not on my radar screen. And to tell you a very quick story of how I got involved in the organization, as you know, one of the hallmarks of the AAN is their annual meeting, and with a gathering of thousands of individuals who have interest in neurology and neuroscience that they meet once a year. And so in my very early days, after I finished my training, I went to one of the meetings. And if you've been there, you realize that you can feel like a guppy in a sea of fish walking around trying to figure out how to connect. I was a young man, and that back in those days, if someone was looking for you, they had a screen that was overhead, a lot of screens throughout the hallways. And if your name was there, there was a center you could go to pick up your message. Well, I kept looking, trying to connect with someone, you know, in this mass of people. And I saw my name and I went to the center, and it was an invitation to come for lunch to discuss a topic. And this was from the person who later would become president of the AAN. And the topic was about how to fund young neurologists who wanted to go into research who couldn't get the funding from our national institutes of health or whatever, and could the academy help them with this? And a lot of opinions, and a free lunch sounded great. And so he liked what I said. He had invited me to an evening meeting, which was another free meal. And that after that, he said, "Do you want to be on a committee?" And so back in the day, that's how I got engaged.
Right.
Absolutely loved the work. The committee that I chose to be on was the one that develops guidelines and practice guidelines. And so learned so much, many articles, and learned how to critique them and how to organize in an evidence-based medicine way. And from there, just was totally engaged with the organization because I saw the wonderful things they were doing, as you mentioned, with education, worldwide outreach, and what they did to really accomplish their vision, which was to be indispensable to their members, and their mission, which is to promote the highest quality patient-centered neurologic care and to enhance member satisfaction. Totally believe that, and that as president now, that's what guides every decision that we make. And so it's been a great journey. Never was something that I had planned from the beginning, but it's something that happened, and I'm so grateful and proud of the organization.
I bet. I remember attending AAA Advocacy Forum 2008, if I recall correctly.
Yes.
On an evening, I just saw that AAN website. It wasn't as flamboyant as now, but still the message was clear. Asking for particular features, I asked from myself, gee, I should probably apply and see. And I sort of quickly wrote something, didn't even check my typos or grammar, it went in. And later on, I got selected and I went there. And to my surprise, my class, the other classmates were the Kathy, previous CEO, Dr. Robert Griggs, the Green Journal editor. I thought these people were some sort of giants that you couldn't approach. But they were very simple, humble human beings who continue to remain great friends even today.
It's wonderful. And that's the other kind of, let's say, secret sauce of the organization are the relationships and bringing people together and teaching them things such as leadership and giving them skills that they can carry throughout their lifetime, whether it be in their practice, their academic center, their community, on any level, to give them tools that will be valuable for a lifetime. But you're right, the best thing always is the relationships that you build.
Funnily enough, I remember I was asking from Professor Bill Carroll, my president at WFN.
Yes.
Professor Carroll, you talk about World Brain Day. Why should people care? And then I realized that that's a soundbite I learned from my first pathology class in 2008 when they were grading us. So you got a story, Tissa. Why should we care?
Correct. And that, oh my goodness, to be able to get the message to people who have no clue, on what's going on, and they have an understanding. And I think the other thing that neurologists intrinsically do, we're definitely believers in giving hope and giving hope to people who felt that there was no answer for them. Well, we're here to be able to change that paradigm, to change that thought process, to let them know, no, there is hope. And there are people out there advocating on your behalf, and that people who want to make your life better and want to find answers to the disease that you suffer from. And I think most neurologists have that intrinsically inside of them.
Absolutely. I think you throw out a pure gold word. The patients, although we talk in numbers, for patients, you and me, we have been unwell before. And when we are unwell, we don't talk about statistics. We have hope. We wanted to get better. We wanted to get back to life and enjoy simple things that we do. Taking a walk in the park, spending time with family, taking your dog out for a walk, having a drink, watching a movie, things like that. I think we as neurologists, our primary goal should be to bring that hope, whatever the neurological disorder that we deal with. And you're absolutely right. When we were medical students, we hardly had any hope in the context of therapeutics. But look where we are now. Some of the strokes, we can basically cure them on table.
It is miraculous. It's miraculous. I was, from our fellow medical students, they would question, say, why do you want to go into neurology? Why do you want to do? And they would tease and say, that's the diagnose and adios specialty,
Yes.
You know what you have, nothing we can do for you. Totally the opposite these days.
Correct.
And it's like, I think it's going to accelerate in the next several decades as far as what we'll be able to do therapeutically. And even more exciting, the possibility of actually finding cures. And we are starting to see those things. I mean, with spinal muscular atrophy, we're looking at what's coming down the line for Huntington's. We're looking at truly we'll have an answer for, which was unfathomable, a few decades ago. And when I was in training, some people thought that would never happen. Well, it's happening.
Absolutely. I think the other entity that you touched briefly is, on one hand, we have all the numbers from global burden disease dataset and publications coming at a fast rate. So we know the size of the problem. And then we have a whole lot of global organizations joining hands together.
Yes.
For a common goal, the concept of Global Neurology Alliance, and then advocating for a common goal and trying to find solutions and promoting neurology, basically to bring the best possible care and hope for our patients, is almost a dream coming true. I think we are.
I agree totally. And that I've seen this in my lifetime. The individuals can do very, wonderful things, interesting things, but to really be transformative, it takes a team. And it takes a team of people dedicated to a purpose. And that's, I think, a wonderful thing of World Brain Day, is to show that united front, to show that, hey, we're in this together, we're working together for the betterment of our patients. And this year, our focus on Parkinson's disease is a very worthy one. that we have great partners from across the globe who are sending that message.
Mm. Jim, we are coming closer to end of the interview. A couple of questions about your normal the day-to-day life beyond
Sure.
neurology. Would you like to share with us? Tell us about your family,
Oh,
pastime.
sure. Sure. And you mentioned it before when you were talking about the patients. I mean, things that I absolutely love to spend time with. One, my family, you know, and my friends that I have. I actually have a daughter who's a neurologist.
Oh,
and
brilliant.
he has my grandchildren who I dearly love to spend time with and see. And I have a son who's in medicine as well on the front lines in the emergency rooms. And so I think about him, look after him, but love doing that. I still remained active in athletics. And so currently I'm a tennis player, and I get to perhaps 2 to 3 times a week with, which is a lot of fun for me. And that from my wife's grandfather, I guess I inherited an interest in wine collecting. So I have my own wine collection and enjoy that, do that in moderation, of course, but have that. And that obviously my lovely wife and I, we're a bit grounded right now because of the pandemic, but when we get the opportunity, we love to travel and see the world.
So you should come and visit wineries in Australia and New Zealand once the COVID-19 pandemic is over.
It's on my list. It's on my list. I would definitely look forward to that.
Jim, anything else that you wanted to talk about? We got a few more minutes that we didn't touch upon.
Yeah, I think it's just the consistent message that, hey, we're all in this together, that really the relationships we build across the world makes us stronger, and that gives us more opportunities to accomplish things that we all envision are possible. I think with the World Federation of Neurology, they do a wonderful thing promoting World Brain Day, and that's something that we should never quit, as I mentioned earlier, in our message of giving patients hope and possibilities. And that I'm always excited to see the young people get involved, because I think it will be a wonderful journey for them, and to see what they're able to accomplish. And that I count you among those young people to see what you accomplish in your career. So very grateful for World Brain Day, my colleagues across the world.
You had an illustrious career thus far, Jim, and you raised 2 beautiful children into almost academic life also. One of the criticism or complaint that I'm hearing from younger folks in particular here in this part of the world, Asia, Oceania region, Africa, is lack of opportunity and challenges that they face. Obviously, different countries, different systems face different challenges.
Yes.
If you were to wind back your early days to sort of 18, 19 years of age, what would be your advice to younger generation who wanted to build a good career, whatever the path that they want to choose to serve fellow human beings?
Yes.
What is your advice to tackle the challenges that they face wherever they are?
Yes, I would say, one, never give up on your passion or on your dream. And do not listen to naysayers who say, hey, this isn't possible. I would seek out those who tell you the opposite message and develop those relationships. And though something may not work out perfectly in one location, it doesn't mean that it cannot work out in the future. And sometimes I think in life we're given those challenges. Embrace the challenge. Don't run away from it. Embrace the challenge, embrace the change, because with that, those are the moments in your life that can truly be transformative. And that in everyone's life, same with my career, it's not always a straight line or smooth road. It's just not. But when things change or you feel the challenge, embrace it, look for the opportunity there, and realize there are people around you who are there who will be your cheerleader, who will be your supporter. And don't let those rough patches discourage you from following your dream. Always do that.
So your advice is forgive, acknowledge rough patches, but dream big, be passionate, and celebrate along the way, and don't give up. Be hopeful,
Correct.
basically.
Correct. Because at the end of the day, that will win. And that is a winning strategy. And that I think wake up every day with that attitude and with gratitude about what's going on. You're going to prevail. You're going to prevail, because I'm so excited when I see the young people as far as their passion. And I want them to keep that when they become an old neurologist like myself, that they have the same passion.
And we should also remind the viewers, American Academy of Neurology had been generous to offer free membership for medical students as long as they are from a medical student accepted by a World Health Organization recognized medical school. So that gives them enormous amount of free resources to learn.
Correct.
I believe access to Green Journal also, although we don't call it Green Journal anymore.
No, but you're right.
I actually got a little anecdote. I remember as a medical student, I grew up in Sri Lanka, which is a small island in Indian Ocean.
Yes.
At that time, there was only one place where you could visit a Green Journal hard copy. For that, I have to take a sort of an 8-hour bus, go to Colombo, and then go to the postgraduate library and have a scan through that journal and come back. Those were the days.
That's dedication. That's dedication and persistence. And see where it got you? Oh, it pays off.
Nowadays, the current day generation, it's not like that. It's all electronic. If you are a medical student and an member, you have it free.
Which is wonderful. Which is wonderful, and that we absolutely are excited that we have such programs. And as you mentioned, our programs across the world and giving those less developed areas continuum and other things so they can further their education in neurology. We feel that's our responsibility, and that we're very happy to do that so we can build our world of neurology.
And it's a beautiful synergy. In fact, I'm incredibly proud. You probably know that I was one of the awardees of Ted Munsat Award for Neurological Education from WFN. And
yes.
He was the one who created Continuum. We don't have time to go through all those stories. Maybe we would have a different chat some other day.
That would be wonderful. I'd love to.
Thank you very much for the incredible the time that you spent with us today. And again, I'm an AN member also, but wearing my WFN hat, I thank AN so much for the continuous synergy and support. And actually the synergy between AN and WFN is a case in point for all other organizations, how it is benefiting everybody.
Correct. And so my message to everyone is continue to stay well, stay strong. We're going to get on the other side of this issue, and that we're going to accomplish great things in the future. I'm confident of that.
Absolutely. Likewise. Stay safe, stay well. Thank you very much. Take care.